So today we'll be doing an abdominal assessment. The first part of this assessment is also to introduce yourself. So, hi there, I'm Brody from the ambulance service. What's your name?
I'm Sam.
Hi Sam, nice to meet you. Can I just get you to confirm your date of birth for me, Sam?
12th of September 92.
Fantastic. So the reason why we do an abdominal assessment, it should be a part of our overall assessment of the patient, but it is specifically important if the patient is suffering abdominal pains or any other issues with the abdominal. So Sam, what I want to do today is just do a bit of an abdominal assessment and see if there's any issues around that. Is that all right with you?
Yep, sure thing.
Fantastic. And as per usual, I have my safety features. I have my gloves on and also my safety glasses. So the first thing I'm going to be looking around is around the patient's environment. So I can be looking at things such as feeding tubes, stoma bags. I can also be looking at any medications lying around, or any indications of dietary habits. These can all indicate problems with the abdomen that I can investigate further. I'm also looking at my patient's appearance and his posture. Does this indicate any levels of pain? Is he fully alert? Does the patient look obese? Or any other issues around the size of the patient? So the next part of the assessment is I want to be inspecting the patient. So first I want to have a look at the hands. Sam, is it all right if I have a look at your hands? So what I'm looking for here is I'm looking for any erythema of the hands, which can indicate a problem with the liver, such as liver cirrhosis. I'm also looking at nail clubbing, which is bulging of the nails and soft nail beds, which again can indicate problems with the liver, such as cirrhosis or liver cancer. So the next part is I want to be looking in the patient's mouth and also the arms. Sam, do you mind if you open up your mouth for me? Great. So in the mouth, I'm looking for any mouth ulcers, which could indicate Crohn's disease. And Sam, do you mind if I look at your arms? I'm looking at the patient's arms for any needle track marks that could indicate drug use or potentially hepatitis B or hepatitis C. So I now want to be inspecting the abdomen, so I'm going to ask my patient's consent to do this. Sam, is it alright if I can get you to lie down and expose your abdomen for me?
Sure thing.
Fantastic. So I'm just visually inspecting it first, and what I'm looking for is any scars that could indicate any surgery or any trauma. If I do find any scars, I can ask the patient what these scars are from and also get a good history of any other medical conditions that may be present. I also want to be looking for any abdominal distension. Any distension could indicate any fluid accumulation. In females could also indicate pregnancy, can indicate constipation, obesity, or any other conditions that may be present within the abdomen. I'm also looking for any masses that I can see, especially if there are any masses around the navel. This could indicate a abdominal aortic aneurysm. Masses can also be a cause from cancer. I'm also looking to see if I can see any pulsation. Any pulsation can also be another symptom of an abdominal aortic aneurysm, also high blood pressure. I'm also looking for Cullen sign. Cullen sign is a bluish discoloration around the umbilicus. This is most commonly associated with ectopic pregnancy, as well as acute pancreatitis. I'm also going to be inspecting the patient's flanks for Grey Turner sign. Grey Turner sign is also a bluish discoloration of bruising that sometimes is around the flanks. This can indicate necrotizing pancreatitis or any other internal hemorrhage. I can also inspect for caput medici. Caput medici is distended veins that you can see in the epigastric area or around the umbilicus. These will extend outwards towards the flanks, also known as palm tree sign. This can indicate portal hypertension. I'm also inspecting for any stomas on the patient. Stomas are a sign that the patient has had some type of surgery, usually relating to inflammatory bowel disease. If the patient has had operations and has a stoma, this can also indicate other issues surgically, such as bowel obstructions or adhesions that can cause further issues, as well as internal hemorrhaging. The next part of my assessment is palpation. So first I'm going to gain consent to be able to palpate my patient. So Sam, is it alright if I just put a little bit of pressure on your abdomen there?
Sure.
Fantastic. So while we're palpating, we're just going nice and softly over the different areas of the abdomen while looking at Sam's face for any signs of pain. First part we want to do in this is through tenderness. If there is any tenderness around the umbilicus or the lower right quadrant, this can indicate a sign of appendicitis. If there is any tenderness in the right upper quadrant, this could indicate signs of hepatitis. I'm also while palpating looking for abdominal guarding. Abdominal guarding is the spasm of the abdominal muscles. This can indicate appendicitis or any gastrointestinal perforation. I'm now going to palpate for the liver. So what I'm going to do here is start at the right lower quadrant and move upwards to the right upper quadrant while asking my patient to take a deep breath in. So Sam, if you could take a deep breath in, please. And out. And out. While doing this, if you do feel the edge of the liver with your fingertips, this is a sign of an enlarged liver. An enlarged liver could indicate signs of alcoholic liver disease or fatty acid liver disease. I'm now going to palpate for the gallbladder using a technique called the Murphy sign. So to do this, I'm going to place my left hand on the patient's most lower right rib, and with my thumb extended into the abdomen, I'm then going to ask my patient to take a deep breath. So Sam, could you take a deep breath for me, please? And out. Fantastic. If there is any tenderness while doing this, this could indicate acute inflammation of the gallbladder. I'm now going to palpate for the spleen. So to do this, I place my hand under the left costal margin, quite far down, and you want to move inwards and upwards while asking the patient to take in a deep breath. Sam, could you take a deep breath for me? Fantastic. And out. That's great. If you do feel an enlarged spleen, this could be a sign of a potential infection. I'm also going to palpate for the aorta. To do this, I'm going to place my hands, palms down on the patient's just above the umbilicus towards the left, and if I can feel the aorta pulsating, I can measure that with my hands, and if that is a diameter more than 2.5 centimeters, that could indicate an aortic aneurysm. I'm now going to palpate for the bladder, also noting that an empty bladder is actually unpalpable. To palpate for the bladder, start at the umbilicus, and you can move down towards the pubic bone, just softly palpating. If you do feel a bladder, this is a sign of an enlarged bladder, which could indicate urinary retention. My next part of my assessment is percussion, so I'm going to percuss for the liver. To do this, start below the umbilicus in the right midclavicular line and work your way upwards. When you hear a dullness, this could indicate the lower edge of the liver, and I can then start just below the rib cage in the right midclavicular line, working downwards until you hear a dullness. This is to indicate the size of the liver. You can also percuss for the spleen and the bladder. Next part of the assessment is auscultation. So what I want to do is I'm going to auscultate for any bowel sounds. So Sam, it's all right if I just have a listen to your abdomen here. Just while I'm doing, just breathe normally. So I'm auscultating the abdomen for any bowel sounds. If there are no bowel sounds within 2 minutes of auscultation, this could indicate a bowel obstruction or twisting of the internal organs. Fantastic. Good. I'm now going to auscultate for brutus. Brutus is a swishing sound heard in the major arteries of the abdomen that could indicate vascular disease or abdominal aortic aneurysm. You can do this by auscultating just over the aorta, and these sounds will usually be heard during systole. No sounds were heard there. During my patient assessment, if I did find any abnormalities in the primary survey, this would indicate life-threatening, and my patient would then be time critical. Also during my abdominal assessment, if I found any issues such as an abdominal aortic aneurysm, I would also class them as a status 1 life-threatening.